All right, let's continue with our revision class. In this particular section, we are looking at the liver. Now, the question will be for you to explain the functions of the liver. So this is very, very explanatory here. Look at it. Excretory function. Just explain it exactly as it is here. Excretory function, which has to do with bile pigment, bile salt, and cholesterol are excreted in the bile into intestine. So please write it exactly the way it is. I may ask you to explain maybe 5 functions. So you explain it the way it is. A metabolic function. Liver actively participates in carbohydrate, lipid, protein, mineral, and vitamin metabolism. The hematological function. Liver is also involved in the production of clotting factors. Alright, and then storage functions. They store glycogen, vitamin A, vitamin D, and vitamin B12, and trace elements such as iron are stored in the liver. Then protective function. Ammonia is detoxified to urea. Kupffer cells of the liver perform phagocytic function to eliminate foreign compounds. Liver is responsible for metabolism of xenobiotics. So you can see that. What are the diseases that are associated with liver? The major symptoms of liver disease is jaundice. Jaundice occurs due to accumulation of excess bilirubin on various tissues such as eye and skin. So when the liver is having disease, when the liver is diseased, or when there is particular condition associated with liver, one of the hallmark is excess production of bilirubin, because bilirubin, the liver is what handles the excretion of bilirubin from the body. And so once there is liver problem, then there will be impairment in the metabolism of bilirubin and its excretion. So the major symptoms of liver disease is jaundice. Jaundice occurs due to accumulation of excess bilirubin on various tissues such as eye and skin. Differential diagnosis of jaundice, you can see it here. We have prehepatic jaundice, hepatocellular jaundice, and obstructive jaundice. These are based on what is causing the jaundice. You classify the liver problem based on the cause of the jaundice. Of course, you have heard that jaundice is excess production of bilirubin and its accumulation. Accumulation of bilirubin precisely is jaundice. All right. So what could be causing the excess production of the bilirubin can help you to diagnose the particular liver problem, where the problem is coming from in the liver. So we have the prehepatic. Prehepatic jaundice is a kind of jaundice that involves hemolysis, leading to excess production of the bilirubin. So in this case, the type of serum bilirubin that is increased is mainly unconjugated bilirubin. Of course, I've taught you in the class that unconjugated bilirubin is the bilirubin that has not yet been conjugated by UDP glucuronide in the liver. So that they are still unconjugated, so they are insoluble in water. So when there is increased excess hemolysis, then there will be, of course, increased production of bilirubin, and it will overwhelm the capacity of the liver to conjugate them. So you see, mainly there will be high level of unconjugated bilirubin present in it. Then in the case of hepatocellular, because there is either deficient uptake or deficient conjugation or excretion by the hepatocyte, then in that case there will be 2 increase. Unconjugated will increase, and also conjugated will also increase. Why will conjugated and unconjugated increase? Is because inability of the liver cells to conjugate the bilirubin will cause excess conjugation, unconjugated bilirubin. 2, the ones that are conjugated, if there are any of the bilirubin that is conjugated in the liver, because those bilirubin are not properly excreted due to accumulation, then the conjugated bilirubin will also increase. You see, when there is liver damage, the ability of the liver to conjugate bilirubin will be impaired. Also, ability of the liver to drain or transport the already conjugated bilirubin will also be affected. So there will be 1, accumulation of unconjugated bilirubin. There will also be accumulation of the conjugated bilirubin, which cannot be excreted from the liver. So in the case of liver damage, there will be both increase in conjugated and increase in unconjugated bilirubin. All right. And then in the case of obstructive, when there is obstruction, in that case the bilirubin have been conjugated, but it is supposed to be excreted from the liver and the intestine. So the bile, which are the pigments that are excreted from the conjugated bilirubin that are excreted from the liver, will not be able to find their way into the intestine, and in that case there is a blockage. So that blockage is called extrahepatic cholestasis. That obstruction, that you call it obstructive jaundice or biliary obstruction. So in a case of biliary obstruction, there will be excess accumulation of conjugated bilirubin, which will eventually escape into the blood and find their way into the urine. We have also liver enzyme. We can also use liver enzyme is an important diagnosis that is used in diagnosing liver disease. So when there is when the liver is injured, maybe there is liver injury, one of the things that you see is elevation of GPT. What is GPT? GPT is alanine transaminase. Please take note. GPT is the same thing as ALT. GPT is the same thing as ALT. Some people call it GPT, some people call it ALT. So for this class, just know that this GPT we are talking about here is the same thing as ALT, alanine transaminase. So the GPT elevated level of GPT indicates alcoholic liver disease and cancer of the liver. So once there is any problem that affects the liver tissue, GPT level will increase. That's ALT level will increase. So every disease associated with the liver will cause increase in GPT. So elevated levels of GPT indicate. Number very, very important for you to know is which is used in diagnosis, is actually the ratio of GPT to GOT. What is GOT? GOT is aspartate transaminase, that is AST. So another abbreviation for AST is GOT. So another abbreviation for ALT is GPT. So in a normal state, GPT is normal, GOT is normal, and their ratio is about 1.1.5. When there is high level of GPT, okay, and then GOT is normal, in other words, the ratio of GPT to GOT is greater than 1. That is, GPT is far higher than GOT. Or put it this way, if ALT is far higher than AST, you will know that there is a case of viral hepatitis. Take note of that. When ALT is far greater than AST, it is a clear case of viral hepatitis. Okay, if ALT or GPT, as the case may be, is equal with AST, then you know it's a case of chronic hepatitis. However, if AST, that is GOT, is greater than GPT or AST, as the case may be, then you will know we have a clear case of alcohol-induced hepatitis. Alcohol-induced hepatitis or liver cancer or cirrhosis, but specifically write alcohol-induced hepatitis. Whenever you see AST greater than ALT, then you know that this is a clear case of alcoholic induced hepatitis. So another condition where AST will be higher than ALT is in a case of acute myocardial infarction. So there are two reasons that you give: acute myocardial infarction and alcoholic induced hepatitis. In these two cases, AST is usually higher than ALT. In a case where AST is higher than ALT, say alcoholic induced hepatitis and acute myocardial infarction. These are the two pathological conditions associated with increased AST greater than ALT. Turn it the other way around. If ALT is far greater than AST, it's a clear case of viral hepatitis. When they are equal, GPT or AST equal to ALT, is a clear case of chronic hepatitis. ALP, alkaline phosphatase, that one is standing alone. Whenever ALP is greater than both AST and ALT, then you see a clear case of biliary obstruction or bone disease. A clear case of biliary obstruction, that is post-hepatic cholestasis or bone disease.